Bismillah Rahman Rahim. Welcome back, friends. Welcome to another video lecture by Kami Biology. Today in this video lecture, we are going to talk about chronic inflammation and acute inflammation. Okay, so in the previous video lecture, if you guys remember, we talked about the process of the inflammation. So before going to explain the chronic and acute inflammation, here I am recommending to you that first of all, you guys need to watch this process of inflammation. Okay, so if you missed that video lecture, so it is present into my channel, or I will give the link in the description box, then you can check it. Now let's start the acute inflammation. So first of all, let me write acute inflammation here. Acute inflammation. Now what actually happen in case of acute inflammation? First of all, let me a little bit define acute inflammation. Acute inflammation is the first phase of the wound healing. It usually occur within a second, it usually occur within a minute, within an hour, or within a days, but it not takes weeks. Okay, it usually activated immediately. Now what actually happen in acute inflammation? So usually acute inflammation are contain two stages. So how many stages it contain? It usually contain two stages. So let me write the two stages here. Vascular stage contain cellular stage. Now first of all, let's explain this vascular stage. In vascular stage, what actually happen? This splinter, once it is injected, then a wound is happen, then a wound is created, we can say. Now once the wound is created, then due to this way, they will cause the vessel to constrict. Now once the vessel is constricted, then the blood flow which is present in the vessels are become slow. Normally the blood flow is not slow, it is in a normal form, not too much slow and not too much high. But when the wound is happen, due to this way, the blood flow is slow. Now after that, what actually happen? The vessel are become dilate. Now once the vessel are dilate, then the fluid which are present inside the vessels are migrated or shifted to this infected area, and after some times they will cause to swell up that specific area. They will cause to swell up the specific area where the splinter are injected. Moreover, what actually happen in vascular stage, the thrombocytes, red blood cells, are also reach to that specific area. Now once the thrombocyte and red blood cell are reached to that specific area, what actually they do? The red blood cell will cause to repair the damaged area, and the thrombocyte will fill up this injured area, or they will cause the clotting formation here. Okay, so that's the vascular stage. Now let's explain the cellular stage. In cellular stage, what actually happened? Again, let's suppose the splinters are injected. They will inject each of the microbes. Now once each of the microbes are injected, then what actually happen? This damaged cells or damaged tissue release some kinds of the chemicals as you are watching. Each chemicals will fall, or each chemical will activate this macrophages and dendritic cell. The macrophages and dendritic cell will eat, or they will perform the phagocytosis process. They will eat each of the bacteria and convert it into small fragment, and then they will present each of the fragment to the other cell. After some times, this macrophages and dendritic cell will release chemokines, and they will attract the neutrophils. Okay, they will attract the neutrophils. We call that chemotaxis. Once neutrophils are attracted by the chemicals, we call that chemotaxis. Now these neutrophils are rolling. Before that, these neutrophils are rolling, and this antigrins attach to the adhesion molecules of the endothelial cell, which we call that ICAM. After some times, these neutrophils are squeezed through this junction. Okay, now how this junction or how this permeability are happen? The permeability are usually happen when the each molecules or each signals or each chemicals which are released from the damaged area are fall on this endothelial vessels of the blood. Then each endothelial cells are separate from each other, due to which we call that permeability. So the permeability are happen, or the junction between the cells are wider. Due to this way, the neutrophils are squeezed from this area. Now this property of the neutrophils, whenever they are squeezed from that specific area, we call that diabetesis. What we call that diabetesis, and the process is called as extravasations. The process is what? This is the extravasation. Neutrophil reach to that specific area, and they also perform the phagocytosis process. Okay, they also perform what? They also perform the phagocytosis process. So if we explain this cellular stage once again, so cellular stage consists in the first stage of the cellular, so we call that emigration. Okay, so in emigration, usually if we talked about acute inflammation, so in case of the acute inflammation, they involve neutrophil, monocyte and lymphocytes. So neutrophils, monocyte and lymphocytes are emigrate in emigration stage. They are emigrate from to this infected area and perform the phagocytosis process. Okay, so after the emigration, so next process or the next stage is phagocytosis. So in the phagocytosis, they will eat or engulf each of the bacteria. Now after that, now third we have exudation. So what actually happen in case of the exudation? In case of the exudation, this damaged tissue release the bradykinin. The bradykinin will fall upon on the mast cell. Due to this way, the mast cell is activated and they will fuse each of the granules which contain histamine and serotonin. So histamine and serotonin are released. Histamine and serotonin are again fall or attaches to these endothelial cells of the blood vessels, and they will cause more permeability of these vessels. So more junctions are created. Due to this way, the fluid which is present inside these vessels are shifted to that area, due to which accumulation of what? Accumulation of the neutrophils, monocyte, lymphocytes. We have the accumulation of bacteria. We have accumulation of tissue debris. We have the accumulation of the fluid and different things, which it make a pus, and the pain is also created. Okay, so this process are usually happening in the acute inflammation. Moreover, in case of acute inflammation, an enzyme is usually activated, which we call that kallikrein. So let me write. So kallikrein are usually activated. Okay, so this one enzyme is activated. So in acute inflammation, kallikrein enzyme is activated. This kallikrein will fall upon on the damaged tissues. This damaged tissue will release bradykinin. This bradykinin will attach to the nerve ending, and after some times they will create a pain. Okay. Now in acute inflammation, whenever this mast cell is activated, so this mast cells, as I told you, they will secrete histamine and serotonin, except that they also secrete prostaglandins and lipases, and they will also secrete arachidonic acid and leukotrienes. Okay, so these are actually the other chemicals which are secreted from this mast cells. So all these chemicals, as I told you, are usually involved in the acute inflammation response. Okay, so that's actually the acute inflammation. Next we have chronic inflammation. So let me write chronic inflammation. Chronic inflammation. Now, as the name suggests, chronic, it is very complicated and complex and very dangerous as compared to acute. Acute inflammation is treated within minutes, seconds, or within days, but it takes longer time and it is very complicated. One thing more, it can also affect on our health. Whenever such inflammation is occur, they can cause obesity, diabetes, and different kinds of disease are created by this chronic inflammations. And moreover, this inflammation take longer time, almost weeks. Sometimes they will take hours, or sometimes they will take months and months and years to treat. Okay, so in chronic inflammation, the damages which is caused are permanently, and in this case they also involve different kinds of microorganisms which are resistance to phagocytosis, and we call that mycobacteria, which can cause tuberculosis and leprosy. Okay, due to this mycobacteria, these mycobacteria are not engulfed by the phagocytes. Due to this way, the inflammation is take longer time, and we usually treat it with the help of medicine and drugs. Now in this case, they will infiltrate the macrophages, and they will infiltrate the lymphocytes. So once the lymphocytes and macrophages are not reached to that specific area, so the inflammation are take longer time to treat. Or let's suppose once it is reached to that specific area, so then each of the macrophages and lymphocytes don't have the ability to engulf the bacteria, because the bacteria at this stage are so dangerous and they are capsulated bacteria. And all of you better know capsule are actually responsible to provide the protection of the bacteria against the phagocytosis. Okay, once the bacteria are not engulfed, then a condition is usually happen, we call that granuloma. So let me write. In this case, the microorganisms are not destroyed, and when the microorganisms are not destroyed, then different kinds of disease are happen, okay, which we call that listeriosis, brucellosis, which is usually caused by bacteria, coccidiomycosis, histoplasmosis, which is caused by the fungi, leishmaniasis due to the protozoa, arthritis due to the autoimmune diseases, means the antibodies are activated and they attack on the joints, which due to which arthritis are happen. Okay. So all these diseases can cause what? They can cause granuloma. Okay, once granuloma are happen, then they will show the sign of chronic inflammations. Okay, so that's in essence about the chronic and acute inflammations. Okay, so I hope you understand about this video lecture. If you like this video, so make sure to hit the like button, share this video, and also subscribe the channel to get more interesting videos lecture like that. And stay tuned, because in the next video lecture on the computer screen, we are going to talk about the difference between chronic inflammation and acute inflammation in more detail, okay, to clarify this topic easily. Thank you so much for watching.